Good morning and welcome to Rest Week. So we have an exercise program that we follow with biking, walking, workouts with kettlebells and other exercise tools. And we also do yin yoga and anything else?
Theory, breath work,
Yes.
and
Yep.
mobility in general, like moving the body, corrective exercises and such.
So our program at the moment is that we do 4 weeks on and 1 week like active rest. So today is the first day of the active rest week, and I don't really know what. Well, I sort of know, but you are head of the recovery week.
The planning.
The planner. So what are we gonna do?
So when I say a restful week, it's usually to give the body a little bit of a break from the physical exercise regime. And we do that in order for the muscles and everything to grow, and also for, our hormones, your mental health, not just pushing all the time, that you actually have a little bit of a break and you give your muscles and your body a little bit of space. And when I say rest week, it's not about, Netflix and don't do anything for a week. It's more about shifting from physical exercise to more restful restorative habits. So this week we'll do a lot more of foam rolling, which essentially was something that Mosh Feldenkrais started many years ago. He started working with Broadway dancers, and they were doing many shows a week. And what they realized was you can't have a massage, a sports massage, several times a day or a week, because that will be equal taxing as an exercise routine. So they started incorporating foam rolling as a form of self-massage, self-care, to promote circulation in the muscle, in the myofascial tissue. The myofascia is like a big compression sock that holds all our muscle fibers and points them in the right direction. So basically, you'll start to align your body, loosen up those tight spots, work with the lactic acid. If we exercise to a point of fatiguing our body that it cannot bring in oxygen, rich blood, or energy, we're going to start to develop something called lactic acid. So we help reducing that by using the foam roller. We can also use different pressure point balls. This is called
My favorite.
peanuts. You can work with two sides at the same time. It's good to work along the spine, up in the neck. This bigger pressure point massage ball is it looks more medieval than it is. They're actually quite soft, and that works for like larger areas like your neck, glutes, lower back, and such. They have more precision, and this one has the most precision because it's the smallest one. So we will use the foam rolling and the peanuts and everything to really just work through the body, the tension, work through the lactic acid, get some good circulation into the muscle. We also keep on our bike routine, but we do it a little bit scaled down. So we're working on getting a little bit of pulse, about 60% max pulse for 10, 15 minutes, something like that. And that is just to promote some circulation. So when we come into the foam rolling, we are already a little bit warm, and the circulation, the juices, the fluids of the body is already moving.
And what about this one?
So this is myofascial flossing, and just as tooth flushing. So I mentioned the myofascial structure as a compression sock, but it's more than that. The myofascia comes from the deepest point of our cells and goes all the way out, and they fill up all the empty spaces in our body, and they also cover all the muscles, the different muscles. And we can see them as big currents or big canals in the body, like they like the chest myofascia goes all the way down here somewhere. So if this myofascia is kind of, imagine you have a shirt that's really tight that's on like this, right? It doesn't matter what kind of movement you're trying to do, it's like I'm kind of off. So what it does, it starts to help you and align the fascia so everything is in the right position.
Good analogy.
Yeah, I just made it up. I'm
Yeah.
actually quite proud of it. It's a good one. So we can open up. So as we're doing more press exercises on Mondays, we'll be working with wrists, elbow, and shoulders today, or arms essentially. Open up the joints and create some circulations of motion into those areas of the body. It is
Pleasant.
an acquired experience. No, it's nice.
Yeah, we'll see. We will show you.
What it does is that it has an element from a Japanese technique called occlusion training, which is basically you cut the blood supply into the body parts. This will stress the body out, the system, and what the system will do is it will send oxygen-rich blood, like energy, essentially to this point. And since that energy can't come into that point because there's no blood supply, we have a big band stopping it, like a tourniquet almost. It's gonna just send more and more there. When you remove the band, it's gonna flood the area and gonna do an internal massage. This can, of course, create a little bit of uncomfortable sensation, especially if there is a mental emotional connection to feeling a little bit of pain or discomfort.
Or located in the area.
Yeah, or actually have pain in the area for an old injury or something recovering.
Yeah, or stagnant energy or
acidity or something like that. So yeah, you can feel a little bit of pain. That's not a bad pain. It's not a damaging pain for us if done correctly, of course. If you know how to do it and someone guides you. But it's a great tool. It's a good addition, and I've seen a lot of injuries heal faster, including my own ACL recovery that I did a couple of years ago.
Okay, enough talking. Let's start doing.
Yeah.
Nice work.
Nice work.
In this foam rolling sequence, we are focusing on the upper body, the back, the shoulders, and the arms. We set an interval timer for 1 minute active work and 10 seconds rest before we change. This is a sequence for about 20 minutes in total. After the foam rolling sequence, we move over to a movement sequence where we focus on the upper body, the shoulders, and the wrists. Here we also work with an interval timer of 1 minute active work and 10 seconds of rests and changing position.
All right, so we're gonna do some myofascial flossing, and essentially it has to do with working with the fascia. The fascia is like a compression sock, much like the tights Sarah has on now, and it helps to align all the muscle fibers in the same direction and transport nutrition and energy to different parts of the body. The fascia comes all the way from our cells and goes out and encapsulates all the empty spaces in your body. So we don't have any empty cavities really in our body. Everything is fascia or tissue or fluid. So anyways, when the fascia is tight, it would much be like Sarah had her tights on like this, right? You're gonna feel that you have a pull towards a direction, or if it's going outwards, it's kind of like the clothes is just fitted in a wrongfully setting, which drives everything in the wrong direction. So what we're gonna do with the flossing is we're gonna wrap it around in the direction that's gonna alleviate for her, create more circulation. So she's gonna do a normal leg extension, just bending and extending her knee, and I'm gonna rotate the skin gently outwards. How does this feel?
Good.
How does it feel if I do it the other way, inwards?
Outwards is better.
Okay, so outwards is the direction we're gonna go. So the way this works is we're gonna restrict some of the blood flow going into her knee. This is gonna stress the body a little bit, so it's gonna send new oxygen-rich, energy-rich blood into the area. of course, the blood cannot come down when we have the strap on, but as soon as we move it, it's going to be like a tidal wave of blood coming in and out, cleaning up the area, which is going to help her with the circulation in the area. So it's great for injuries, it's great for tightness or tension. So I usually start here, maybe mid shin. And then, of course, you have to see with the person you're doing this with how tight you can go. It's good to have something in between because it can create skin burns sometimes, and that can be very uncomfortable. It's not dangerous, but can create some unnecessary stress at times. And then I leave a little bit of space so I can insert it. So now we did the lower portions. Next we're gonna do the upper portion. And from here, basically she does some leg extensions. She has a sock on now so you can't see, but sometimes when you do this, your foot can go a little bit palish, it can change colors. That's not a major issue, that's to be expected. About 1 to 2 minutes, or when you feel, take it off, please, now. That's a good sign. But about 1 minute to 2, sometimes you can do longer depending on the area and the person you're working with and how many times you work with the tool. I wouldn't do this if there is high blood pressure or heart vascular disease, because that can affect, you can stress the system out a little bit, or DVT. But if there's any medical conditions, then always consult your physician first prior to doing things like this. Okay, so how are you feeling?
Yeah, it's good.
Yeah. So from here, can I remove it? And now it's not too tight, but sometimes when you put it on, it can be really tight. So I try to be swift when I remove it.
I hope you enjoyed this video, and hope you get inspired to also do like a rest week to take care of smaller parts of your body. And if you need any kind of support, please reach out. You can email us at support@livingwiththespirit.com, or you can write a comment, or yeah, you can reach out through any of our media. And please like and subscribe if you enjoy this video. It will help us so much. We really appreciate it.
Yeah, and as we said, this could be as a restful week, but this could also be as starting out a new workout routine, that you start with something a little bit slower, more mindful, and tune into your body. If you're coming back after an injury or a burnout, or if you haven't been physically active for a while, it's a great routine to start with, because you're kind of winning each session. You're winning, you know, you don't feel blasted or beaten down by the exercise. You felt that you leave, you feel a little bit looser, more circulation, and that in turn gives you more juice or more energy into your day. So yeah, really try it out. And as Sarah said, like and subscribe us, and you'll get notifications when we do more videos and webinars, and can ask us questions. If you have a specific topic, we might record a video to your question, and it could be it is a thankful way that we've done now for a while. Record some videos when there's specific questions, because chances are there are more people than you that are wondering the same thing. So don't be shy, just throw away the questions and we answer them as well as we can.
Thank you.
Thank you.